think a lot of people who are interested in primary care come at this field because we see this gap. And so you really kind of have to treat primary care like the specialty it is. If we're doing our job as best we can, we're trying to give every opportunity for patients to come alongside us and get healthier.
The rural resident experience is like living the life of a family doctor. You wake up in the morning, you take care of your patients in the hospital on inpatient rounds. After you finish there, you come back to clinic and you see your patients, whether it's your family medicine clinic or if you're in OB clinic taking care of OB patients that day. Sometimes you go to the nursing home and see your nursing home residents. It's learning how to incorporate all those things into one day.
Having a resource as great as Cahaba, you're truly able to serve what the community needs. Being able to be the ER physician, being the nephrologist, neurologist, these are places that people don't want to go, that we are going and providing that care. With our preparation here, we are able to deal with and manage those cases, which brings me to the point of why access is so important. Instilling and kind of building this practice here, we're kind of in a location to access places that access wasn't previously available.
It helps get doctors into places where they're needed the most. It trains them how to take care of those patients. If you learned big city medicine and that's all you did, and then you tried to move to a rural area, you kind of have a challenge figuring out how to tailor their specific needs to a rural population.
You're going to get the advantage of being in the rural setting, on the ground, up close and personal with rural care.
This is an authentically rural residency with a hospital component. Our clinic shares a parking lot with our rural hospital. We are two different entities, but it is an absolutely synergistic relationship. This hospital, Bibb Medical Center, is extremely visionary. They've got energetic community leadership. We have become 90% of the medical staff at this hospital. The obstetrical staff, part of the emergency room staff, even some nurse anesthesia. It's the synergistic relationship that has made this a really special place to train outpatient at Cahaba, but then inpatient at this rural hospital that is thriving.
Before our labor and delivery unit opened up here in Centerville, our pregnant patients were having to go 45 minutes to an hour out for obstetrical care.
Rural OB care is so important to this community. We have an ability to reduce mortality and actually kind of integrate. In terms of practice-wise, it allows us to build and grow.
We are so fortunate to be able to provide them with a prenatal clinic. They can have their ultrasounds done here. We're actually trained as providers to perform those ultrasounds, so it's a learning opportunity for us.
Not only are we delivering babies, but those babies become our pediatric patients.
When you are on call in the hospital, you'll cover L&D. So if you have any deliveries come in, you will be the person in the delivery room.
My ER experience is awesome. I have gotten to see so many different things. Here in our curriculum, when you're on call, every night you go to the ER. Being a kind of rural access facility, we see a wide variety of pathology. In some way, it kind of instills confidence in your ability to be comfortable in your skill.
Nursing home is kind of an integral part of what the residents do every week. So they really get to know the patient, they really get to know the family. It really allows them the opportunity to learn geriatric medicine.
We're responsible to manage and get to know and become central to their care. Us as the residents that are primarily involved in their care are the ones that see them in the hospital, follow up with them afterwards, and just manage them and see them every few weeks.
Learning how to do that component of medicine well will serve you well no matter where you land. There are people here who are forgotten and who are not being seen. Kind of having that opportunity to do that work every day is definitely rewarding.
I'm proud to be a part of Cahaba.